Thank you all for being here on this lovely Monday, the holiday, right? Spend some time with us to talk about the important topic that is scoliosis. And we really termed this the scoliosis do's and don'ts because we have so many people who come in here and they just don't know what to do and what to do. So we're going to hopefully fill in those gaps a little bit today. We got it set up for about 30 to 45 minutes. We'll be together. I'll be talking for hopefully around 30 minutes. I'm gonna try and not go over that. I have a tendency to rant at times, so we're gonna try and not do that today. And then we'll set up a few minutes at the end for any questions that you guys have, a little bit of one-on-one. And then anything that you guys would like to send to us separately, we'll have our information, like our email at the end. You can send us a message privately through there if you don't want to ask a question with multiple people on the call today. Besides that, we'll just get rolling here. Perfect. Let's see. Maybe it's going to roll. There it is. Okay. Gotcha. So what can we expect today is the beginning of all this thing as to why both myself, I'm Dr. Anthony, and then Dr. Mark, my father, why we became scoliosis specialists and kind of why it's close to home for us, as well as what scoliosis is, who it affects most commonly, what those signs and symptoms are, what are the options when it comes to treatments. There's multiple options depending on who you talk to, and for other people there might be no options, right? So we're going to get to the bottom of that. If we've had a spinal surgery, what are some things that we can do to mitigate the symptoms as we get later on in life? And then is there anything that can go on with making scoliosis worse? And then we're going to add a bunch of stuff in as well. We're a chiropractic office here, but with a very specific scoliosis approach. So we'll be diving into that as we go through today. Little bit of background, as you can see, I'm on the top there, Dr. Anthony, and then my father on the right wearing the jacket is Dr. Mark. And so I graduated from chiropractic school about 3 years ago now. Dr. Mark graduated in 1992, I believe it is. So he's been practicing for well over 30 years. He got more into the scoliosis game a little over 10 years ago. And one of the main reasons for that was because my sister actually has scoliosis. So he wanted to go through and find out if there were some more specific ways he could work on addressing her scoliosis beyond the chiropractic scope, which is both of our scopes. And he went and found this program called the Schroth Best Practice program. We went out to Boston. He got trained in it, brought my sister. She was trained in it. And we had some awesome results. So he went and learned the Schroth Best Practice program. And the thing we loved the most about that is that we had our own tools at our disposal and didn't have to rely on anybody all the time. We could just do a quick Zoom call or FaceTime to really get one-on-one time going over how we can specifically address our own scoliosis on a daily basis. So the other part of that is if you're in our office, Lori, my mom, she also has scoliosis. Back in the day, back in the 70s, they were still doing Harrington rods, which if you don't know what that is, that's great. It's when they used to put big titanium poles down the spine to help straighten them or take away the curvature. So we want to make sure people are not going through a brutal route or the brutality that can come with scoliosis and surgery. And we can have a lot of other things that we can do on a consistent basis to really mitigate those symptoms and responses. As we continue on here, one last thing before we get going into this, if you've got questions that you want addressed at the end of this, please submit them into the chat, send them to our email, whatever you can do, get those questions to us, and we'll definitely go through it at the end, or we can always set up a time to talk more specifically one-on-one afterwards. All right, so to understand why scoliosis in general, why posture, right? Just a couple very basic quotes over here talking as to why we need posture, why posture is important. So to live a long, active, energetic life, few things matter more than good posture, right? If we are holding a bad posture, it actually takes more energy to do that than a good posture. And we see with the introduction of social media, technology, kids going to school from home, posture was at probably an all-time low over the past few years. And it's safe to say most people in our world experience that or are still experiencing that. And the reason that is yes, it's the bad posture, but it's the picture over on the right here, which is our spine and its connection to our autonomic nervous system. What you'll see is there's a direct connection between everything that has to do with our spine and the rest of the function of our body. So if that spine is in abnormal positions or in a position with a lot of tension or torsion to it, that's going to be something that has systemic effects, as we'll see with one of the other quotes over here. Posture affects and moderates every physiological function from breathing to hormonal production, spinal pain, headache, mood, blood pressure, pulse, and lung capacity. Those are just some of the things, right? And you might think, well, how could it have so many effects on our body and our health? And it's because that spine connects to every single organ that our body has. So if the spine becomes altered or stressed in an abnormal way, we're going to have a lot of compromise or compensation to other bodily activities, simply put. And so now that we got a base with posture, it's really going to be more, what is scoliosis? And the basic definition for scoliosis is a sideways curve of the spine with some sort of three-dimensionality to it. So what we'll see is it might just be the side tilting of the spine, or you might see one shoulder drops, but we're also going to have a curvature rotational aspect of it, because there's no scoliosis just 2D or two-dimensional. They're all three-dimensional. And so what we'll see on the right side here are all the different options you can have with it. Within our scoliosis classification system that we use, there are 7 different classifications. We just have 3 up here today, very basic for us. On the left side, you'll see that structure is showing how these 3 body blocks that are our head and shoulders, our thorax, and our pelvis, we'd like to have them sitting straight on top of each other. That would be what we'd call neutral or a perfect spine. When we go to the right, what we'll see is the first indication of those body blocks going off, with one shoulder going forward, one thorax going backwards, and the pelvis going forward on the other side as well. The main thing we're getting at with those body blocks is they just don't align anymore. They're somewhat off. If they go off for too long, we look at bigger issues. But the other options when it comes to curvatures, there's 3 curve and 4 curve. Some of them have 3 gentle curvatures to them. Some have 4 curvatures to them. So just helps us with being as specific as possible when it comes to the rehabilitation and correction of these. Just a little bit more information as to how you can have different classifications on these curvatures. And then even on top of that, we might have something that's more mild, moderate, or severe based off of that. So anything that's going to be sub 10 degrees of curvature or less than 10 degrees is actually not a scoliosis. Anything from 10 to 24 degrees is going to be a mild. And then from 24 to 49, moderate, and anything above 50 degrees is going to be a severe, and most likely needing some very urgent intervention or intense intervention to really make sure that we can avoid surgery with that. So there is the basics for scoliosis. Just like we were seeing before, there's a lot of different curve patterns. Not everybody fits perfectly into these textbook definitions. But within all the different curvature or different areas of our spine, the cervical, thoracic, lumbar, and pelvis, we're going to have a lot of those ones being involved in the curvature. For the most part, scoliosis is going to be involving the mid-back or the thoracic spine, as well as the lumbar spine. One of the reasons that you'll see almost every one of these classifications has a thoracic and lumbar component to them. So there's the general thoracic curve, which is going to be primary up in the mid-back. There's the lumbar curve, which is where our intense curvature is going to be in the low back or the lumbar spine. And then there's the thoracolumbar curve, which is going to be where our major or our primary curvature is spanning from that mid-back, the thoracic spine, into that low back. And then the other ones that are options for us are going to be double majors. All that means is that we have even curvatures in the upper back, the thoracic spine, as well as the low back. So we'll see it might be a big sweeping curvature where it's even on both sides. No curve is bigger than another curve. And then the triple curve is going to be very similar to what we were looking at on that previous slide, where there's the 3 curve versus the 4 curve. So those are the options when it comes to our typical curve patterns. But again, a lot of people have different curve patterns and they'll always fit into these boxes that we create. When it comes to understanding the various definitions, there's a lot of different, ways scoliosis is thrown around. Most people are always using the term idiopathic scoliosis and not one of the other ones, which we'll see below, which is a congenital, more serious one, as well as a neuromuscular scoliosis. So those are both ones that, although we can help with those, it can be more difficult cases to handle. So a lot of this information is tailored towards the more idiopathic scoliosis, which is more of the 80–90% of the cases that we run into or that are in the world in general. When it comes to different classifications for idiopathic scoliosis, Some of them will be at a much younger age. So that's what we usually call our juvenile scoliosis. Um, those are going to be more intense as well. We'll have different recommendations based off of that. So if you've had intense curvatures that are showing up before the age of 10, that's really something you want to get ahead of, because bracing as well as intense exercise intervention is most likely going to be recommended. Late onset is going to be the more consistent with what we're talking about. The majority of cases are going to be late onset. Between 10 to 17, that's when most people are really growing skeletally. So a lot of those kids, usually it's the girls a little bit younger than the boys because of puberty and things like that. But we really want to make sure that with adolescents that we find out in that age where they're growing the most, so that we can tailor care to them while they're going through growth spurts. If they're going through growth spurts and we're not doing anything to limit the curvature growth or give input to the curvature in a way that's going to be more beneficial rather than worse, we're going to have a tougher time correcting it once they do get closer to skeletal maturity or over the age of 18. And then for adults, most commonly what we deal with our patients is that as they're getting older, it's something that just wasn't dealt with when they were 10 to 17 years old. Now they're 25, 30 years old, dealing with symptoms most of the times. Might be pain. A lot of times it's just much more tightness on one side of the back than another. They might have one hip that feels tighter than another, or feeling like they're walking on unlevel ground, one leg being longer than another, are really the common things that we'll see. A couple really simple definitions we also wanted to throw in is, what is a Cobb angle? So Cobb angle is a huge term thrown around in scoliosis that not everybody knows what it means. A lot of people do. All that is going to be is just the angle that the curvature is created. So when it comes to all these curvatures, some of them are going to be bigger than others, but we're going to make sure we get a Cobb angle for each curve that you have. So if it's in the thoracic spine, we'll have a Cobb angle for the thoracic spine, one for the low back, and then one for the lumbosacral curvature as well. This was going back to mild, moderate, or severe. That's one of the ways that we diagnose or tell someone if their scoliosis is mild, moderate, or severe, is going to be based on that Cobb angle. And then just a moment ago, you heard me mention skeletal maturity, also known as bone maturity. So people are more likely to have their curvatures increase or worsen when we haven't reached skeletal maturity. Once we reach skeletal maturity, which depending on what you read, might be anywhere between 22 and 32 years old. So it's something you want to be aware of. A lot of the times they tell you it's 22, and it can really be longer than that. So pay attention to it. If you have any x-rays, send them over. We can always check that to see where you're at with skeletal maturity. And really making sure that we do as much as we can before skeletal maturity, because we can make a lot more changes or moderations to the spine at that time. As we continue on here, common signs, we did a post on our social media the other day about this. Most common ones you're going to see is going to be uneven shoulders, shoulder that's protruding forward, because remember, these scoliotic changes are three-dimensional, not just one-dimensional. Might have an uneven waistline, feeling like one short is higher or lower on the hips than the other. Noticeable muscle tightness for a lot of our patients. It's when the paraspinals in the low back and the mid back, one side feels a lot tighter than another. And when they try and stretch those muscles one way or another, one's much easier to stretch, one's a lot harder to stretch. Those are the most common ones that we'll see. And then when it comes to being able to notice these symptoms, the best places to notice this, obviously, if it's your own kids, just being aware of what's going on. But a lot of times their gym teachers or their sports coaches might notice it because they're around them so much. If they're playing in sports, a lot of times it's in tight clothing, so you can see some of these things more noticeably. So those are the times we really want to be aware of these signs and symptoms. And then one other thing we'll throw in real quick. If we're dealing with frequent back pain or discomfort and we're under the age of 16 years old and we haven't had a major sports trauma or a car accident, we really do need to get that checked out. Most of our patients who come in with scoliosis should not be in pain. If you're in pain, that means there might be more things going on with it. We're talking about that younger age, the adolescent group here. So if we're dealing with pain, make sure you get that checked out. Might even get an MRI just to make sure there's nothing worse going on. And then a big thing for everybody with scoliosis is lung capacity. If the thoracic spine is involved with that curvature, that means the lungs and ribs are also involved. As much as we can do to minimize that curvature, decrease the rigidity of our rib cage, then we get normal lung function. If our lungs are being compressed by a rigid rib cage and rigid thoracic spine, then we're going to get tired more often. We might be more prone to asthma, cold stick around longer, not going to be able to exercise like we'd like to, all of those things, right? We want to make sure we do everything we can to maintain that lung capacity. So how does scoliosis progress? So this is just a very simple chart on how it happens. There are many theories as to why scoliosis develops. No one has it specifically. There are hereditary components to it. There are trauma components to it. There are nutritional deficiency components to it. So it's all over it encompasses many things, is the way that we'll put it. One of the common ways, once we get a curvature that's developed, the way that it gets worse is because we have a curvature that's caused asymmetry in our spine. If we have asymmetry for too long, our body starts to develop bad habits or adapts in a certain way. So asymmetric loading is what we do for the time and time again. And then all of a sudden we get a more severe deformity that's going to be the result of long-term asymmetric loading. And so when we lose our normal curvatures, I'll give you a different view. When you look at we're going to call this the sagittal plane or the side plane. When you look at the spine from the side, we should have 3 curvatures, one in the neck, one in the mid-back, and one in the low back. One of the theories as to why scoliotic curvatures develop more often is because if we lose these curvatures, our spine loses its ease or its stability against gravity. So then our body, with its intelligence, puts in scoliotic curvatures as a way to create stability for our body against gravity. So for a lot of these kids that you see these days that are just completely hunched over like this, looking down at their phone, looking at whatever it is, they're much more prone to these scoliotic changes because their normal curvatures are just gone. They're not where they need to be. If you do that long enough, these are the kind of changes that will happen. So really making sure that with our youth especially, we get those normal curvatures or our normal posture to be as maintained as possible. And then for our older patients, sometimes just working on this general sagittal curvature, sitting up straighter, keeping those normal curvatures intact can be the difference on minimizing the amount of pain or limitations you deal with on a daily basis in your life. If you guys are with me on that. Okay, let's check my time, see where I'm at. Okay, cool. As we're cruising around here, when it comes to deciding what you're going to do with treatment options, right? There's some basic things that we want to make sure we have across. We want it to be a very effective program, right? To be a high quality program. Short amount of treatment times. The program that we do in our office now, it's around 8 to 12 hours, depending on how old we are. Some kids go up to 17 hours, but it used to be like a 6-month program where you'd go stay somewhere for 6 months and get it done. In our world, that's just not the most realistic thing in the world. So that's why they recreated this program to be much more doable at home and not having to spend such a long time of the year or time of your life learning these exercises. On top of that, comfort and best service are a huge factor for us. And the last thing, and arguably the most important, is the least amount of side effects, right? When it comes to a lot of these different options, even bracing to a point, but definitely surgery, there's a lot of possible side effects that don't always get discussed with our patients. So we want to make sure that we get those side effects across to you. And if you'd like more information, please ask. We want to be as conservative as possible, especially getting started. So that's why when it comes to the different approaches, they might be giving you the wait and see approach, right? So let's wait and see. But let's not just completely wait. Let's wait to see if it gets worse to a point, but also do something to minimize its increase during that time while we're getting towards skeletal maturity. Because there's always things that we can do that are very simple to minimize how much it's going to affect us down the road. The wait and see is just a not very proactive approach, completely reactive, which is not one that we adopt very much around here. So yes, this is on to those options, right? And so I love the first one when they create all these on the scoliosis recommendation websites that they create. Is observation is the first one. So you're just observing whoever it is, whether it's yourself or your child or an athlete or someone in your class if you're a teacher, right? Doing nothing. You're just observing and seeing what happens if it gets worse. And this is only going to be for children and adolescents, or as you're getting older, up towards 60, 70 years old, becomes harder to resist gravity, curvatures may increase. But with kids, for the most part, you're just trying to see, are they getting a lot taller at that time? That's going to increase the curvature. Are we noticing that they're sitting with worse posture on a consistent basis? Those are the kind of things that we want to recognize to see if it's getting worse. I'd really recommend if we have any sort of hunch that it might be happening, that we do something to be proactive, get it checked out. Simple assessment takes 30 seconds just to see if there's a possibility of having scoliosis. So you got to have it done. And real quick, not even all the schools in America are doing that anymore. I believe 2/3 of them recommend it, don't even mandate it or anything. So there's a lot of kids that are going unseen or unchecked for scoliosis. And one of the reasons we're getting more people having scoliosis, there's already 2 to 3% of our population, right around 7 million. So 2 to 3% doesn't sound like a lot, but when you're dealing with 300 million people. Anyways, back on topic. The other options, physical therapy is a very common one we see. Most of the time, it's only going to be for adults who are dealing with some sort of pain over 35 degrees, or it's going to be in kids who are in growth and they've already found that they have a curvature. So if we've got a curvature above 35 degrees and we're adult, we're probably getting recommended physical therapy. If we're under 35 degrees, but they found a curvature and we're a kid, they're also probably recommending physical therapy. The other one that we really are big fans of, especially in younger people, or if we're in our early 20s and we just can't do enough exercise, bracing is a great option for people. Usually they don't recommend that until you're over 25 degrees. We really try and be proactive about it. If it seems like we might be heading that direction, let's get the brace on sooner rather than later. We have a couple brace recommendations, which I'll show in just a moment here, because not all braces are made the same, believe it or not. And then another option that a lot of patients go with is spinal fusion surgery, and that is one of the tougher ones that we've seen. There are moments where there's no other option, without a doubt. So if we've had that surgery, there's definitely still things that we can do. The biggest thing is making sure that we understand what the effects are down the road and the ways that you need to be involved on a consistent basis to minimize its effects down the road. If we do that, we can live a very long, fulfilling life with a surgery, no problems, right? We can do that. And then I have corrective chiropractic care at the bottom. Not all chiropractic care is built to be corrective, using x-rays and the physics to know exactly which ways we need to be adjusting to create a better curvature, both in this plane and in this plane. When we do things like that, we get really awesome changes with our patients. Some of our patients who undergo corrective chiropractic care and don't do any specific scoliosis exercises outside of our office, we still get pretty awesome results in terms of curve number reduction. So those are the usual options. And when it comes to the different spinal curvatures that we have, right, what we're showing on the side here, on the left side, you'll see there's the straight up and down picture of the spine, and then there's the spine from the side. And that's really what I was trying to show is, when we're addressing spinal curvatures, the first thing that we need to address is that normal curvature of the spine. As much as we can get that side view back to normal with those 3 gentle curvatures, then all these other scoliotic curvatures that are in that right picture won't progress as much, or won't feel the need to progress as much. So one of the biggest things that we start with most of our patients is on this left-hand picture, making sure that we get those 3 nice curvatures when we're looking at the spine from the side to be intact. Those are huge for us. And then alternative options, this is what we went to and were trained in by the Schroth Best Practice method. It used to be a really long program. It comes from Germany. They spent a lot of time developing and perfecting this. And then the people that we worked with out in Boston, they spent a lot more time trying to make it functional for people to do at home on a regular basis. Instead of having to have all this crazy equipment, we make it very simple and easy to be done at home, very convenient, so that you can feel in control and empowered with what's going on with your own scoliosis, and that not like it's just happening to you. And that's our biggest thing when it comes to this whole webinar, is we've just had a lot of patients over the last year that come in all sorts of places: angry, sad, frustrated, and emotional, like all these different emotions and feelings, right? And we want to do everything we can to help people not have to show up like that anymore. If we can give a little bit more information, whether it's to you and you pass it on to more people, it helps people recognize that we can do a lot of cool things, and the diagnosis of scoliosis and all the symptoms that might come with it is not the end of the world. We can do a lot of cool stuff, and we're just trying to spread that message. So this program is what we use. It is very specific to whatever curvature you have. Like I said before, we have 7 different classifications that we use to come up with a curvature diagnosis. And then we tailor everything to that diagnosis. So we have a lot of different ways that we make your life and everything that's going on with your life specific to the curvature that you currently have. When it comes to physical therapy, they commonly will just be focused on spinal stabilization that has nothing to do with asymmetry. Scoliosis is in its nature asymmetrical, so we have to address it asymmetrically as well. If we just do general core strengthening, low back strengthening, we're not going to change any curvatures. It might not actually get worse, that's a chance, but we're not going to get better. That's for sure as well. The 5 parts of this program that we use, because and as I was saying, it uses a lot of different parts of your life. So one of them is going to be the activities of daily living. We want to tailor every single thing that we do in our life to our curvature or to our scoliosis. Then there's going to be our mobilizations, which is just simple kind of like massage to the muscles as well as to the rib cage, things like that. And then we have our actual 3D exercises, which are the most intensive things that we do, hitting with a lot of asymmetry, making sure that we get huge corrections with those curvatures. And then we take that most intense form of exercise, make it a little bit simpler so that we can do it on the go. And we call that our 3D made easy. It's all the intensity of the other stretch exercises, just with minimal equipment so that you can do it if you're on a walk at the grocery store or if you're at work. So that's the simplicity of it. And yes, as it says at the bottom, our aim is really to educate, enable, and empower the patient. You can be so involved in this process, as involved as you want to be, towards making this as minimally noticeable in your life. So that's the way we play it. The goals for all of these, right? The most important one is it allows those with scoliosis to help themselves. Like you don't feel like there's nothing you can do, and each day by day, it's getting worse. This is the way that you start to build some momentum. You're consistent with something. You start to feel better about it internally as well as physically, right? So then all these things come together, the mental and the physical. You feel like you're really starting to build something that's not going to just break down over time. As we get older and older, it becomes harder to resist gravity. People with scoliosis are more likely to fall into those curvatures. So as much as we can do things to strengthen our ability, increase our ability to resist gravity, we got to do that so that, again, we don't start to crumble and fall into those curvatures as we get into those later years. So curve progression is huge for us. If we can reduce it, that's icing on the cake, even better. Spinal stabilization, lung capacity, vital capacity, those are huge things for us. And then for a lot of our patients, the most important thing is simply just postural appearance. We want to be able to wear this shirt or wear this bathing suit without it being obvious that we have asymmetry in our spine, asymmetry in our muscle tone and our posture, all of those kinds of things. So for a lot of our patients, the numbers don't really matter that much. It's really just how can we make it so that when we go out on our day, we just feel a little bit more normal. And that's a huge goal for us. We want to feel closer to normal, right? Like our posture is as normal as possible, but also that we're strong, confident, holding ourselves up tall, and we don't feel like it's so noticeable to everybody that we're walking. And then yes, reducing pain is also a plus. This is the bracing option that we use. We have an orthotist that we work with up in Los Angeles. If anybody would like to be connected or like more information on that or like to talk with me more about why you might need an orthotist, please let us know. The Chanot-Gensingen scoliosis brace is the one that we use. It is very asymmetrical by nature and very firm. And so it allows you to actually be able to do some of the corrective breathing exercises while in that brace. Whereas a lot of the other braces that people use just are not asymmetrical in any way, and they don't actually get the things done that we need to get done. If you were interested in seeing pre-post x-rays with these braces, I was not able to get this in the presentation today, but we can definitely get that to you. It's pretty awesome stuff. And you'll see that they're quite asymmetrical with huge pieces of plastic going up and beneath the armpit on one side, not on the other side, really trying to help out with shoulder unleveling, hip unleveling, as well as the rotatory components that are going on with these scoliosis changes. When it comes to making scoliosis worse, probably one of the most common questions I get is yoga going to help my scoliosis? Is Pilates going to help my scoliosis? And while it's hard for me to want to say that they make it worse, I can very confidently say they're not going to help your scoliosis. They're going to increase mobility to a certain extent, but we have to remember that scoliosis is very unstable in nature, which is one of the reasons we put those scoliotic curvatures in, is because the spine doesn't feel stable. And so Pilates, yoga, they're very big on mobility, but not really strengthening and stabilizing the spine. We have patients who go through our program and like to do Pilates and yoga, so they continue doing it. And that's fine as long as we're doing enough on the side to be able to get the strength, get the stability, get all those other things that we're going to get from that Schroth program or scoliosis rehabilitation. And then we can do the Pilates or yoga just for good exercise, good release, whatever it might be. We can get things out of that. It's just not going to be better for our scoliosis. So that's a huge thing we get. So we want to talk about that. And then a couple simple questions that we'll talk with about here. And then if there's any more questions, we can go through them. We've had plenty of patients who come through with spinal surgeries and want to get help. We help them with chiropractic care, non-invasive chiropractic care, no popping or twisting, all instrument adjusting, which is another conversation. And then the Schroth method, we can do a lot of really cool stuff, even though we have a spinal fusion surgery, because we can really work on above and below the spine to make sure that we keep those areas healthy and they don't break down and degenerate over time. So yes, we can do a lot of really cool stuff, even if we've had surgeries, even if we had fusions anyways. And then if we have a lot of pain with scoliosis and we're worried that it's going to get worse as we get older, it's a really common thing that we see that as people get to that 60, 70, 80 years old, and they've had a scoliosis since they were 20 years old, something like that, it commonly gets worse at that time because those muscles are so asymmetric at that time. One's a lot stronger, one's a lot weaker. As we start to get older, it becomes even harder to stand up straight and resist gravity. So those curvatures, our bodies start falling into them because we're not able to maintain a neutral spine or try and stand up. So those muscles, they break down, they lose strength, they fatigue over all those years, and that's what makes us feel like our curvature get worse. And the curvature getting worse commonly comes with more pain at that time. So we want to make sure that we are strengthening and increasing our endurance and stamina at an early age before we end up in those later years, so that when we go out and about, we feel good, confident, no fatigue, no lack of energy. All of those are exactly what we're looking for. And then when it comes to will a brace help me as an adult with scoliosis, the simple answer is yes. And at that point in time, we really want a passive component and an active component. The rehabilitation exercises are the active component where you're doing something. The brace is the more passive component, which we think that every good plan should have an active and passive component so that we're coming in it from all angles, or as many angles as possible. And for our adult patients who want a brace, the real reason we'd recommend it for them is if they just didn't have enough time to be doing the active component or the scoliosis rehabilitation exercises. This brace can be a great thing to help maintain your spine, make sure it's at least not getting worse when you're waiting to be able to have more availability or time to do those exercises that are necessary to really move forward and correct that curvature, or at least make sure it doesn't get worse. So I believe that that is the end for all that we had for you guys this afternoon. I really appreciate you coming. If you have questions that you want to send to me specifically or to our office to have anything, have us follow up with you guys, that is our email and phone number. If there's some questions you have that you don't want to put into the chat right now, feel free to send them to that email address. We'll make sure to get back to you as soon as we can. Besides that, I'll hold on here for just a few minutes to see if we have any questions. And if not, you guys have a lovely Monday. Enjoy your time. And thank you guys so much for spending this time with us. We really appreciate it.